Hello, everyone. Welcome to Encron webinar series today. My name is Jill, and I'm an aging state specialist at Iowa State University. I apologize for uploading this later than expected, but hope you can still learn and enjoy the helpful information for your target audience or any other older adults. Today, I will be presenting future care planning for community residing old adults. This is today's agenda. First, I will share some background about future care planning, and then some important context to consider. Then I will discuss how future care planning has been defined in the literature. There are some interesting findings related to future care planning, so I'll share some key findings, like especially factors that are often associated with the future care. Then I will introduce future care planning program currently being implemented in Iowa through extension and outreach. Community dwelling old adults often worry about health events, obtain responsive care, and being burdened to others. Although many adults are aware of impending frailty and death in later life, relatively few make plans for their care. That is, other than the financial and end-of-life documentation, such as will, a few actually make other concrete steps or prepare for their own health care or arranging their social networks. Recently, literature has consistently addressed the need to extend our framework of palliative care, which typically focuses on the end-of-life spectrum. That is, right before end-of-life care, we need to think about stages that old adults go through while living independently. Frailty in later life is quite common. In fact, most old adults over the age of 65 are often considered to have one or two frailty symptoms, considered as pre-frailty stage. This poses a significant dilemma for old adults because the vast majority of whom want to aging in place and maintain their autonomy as long as possible. In particular, frailty poses special challenges to how we organize and how we access to the healthcare. Often, this frailty leads to several social, physical withdrawal, as well as more frequent hospitalization, including ER visits. Let me share some realistic pictures using the survey conducted by AARP in 2013. In their survey of old adults over the age of 60, they found that many old adults, approximately 90% of seniors, intend to live in their current homes for the next 5 to 10 years. Of these individuals, 85% are confident in their abilities to do so without making significant modification to their homes. When they were asked whether they did make any home modification to help them in aging in place, less than 20% said yes. Most of them said, however, they could see the potential need, but did not plan to make any plans to modify their homes right at the moment. And this was true regardless of their socioeconomic status or the financial resources they reported. Specifically, more than a third of old adults in the survey were not confident about these things. They did not know all the government benefits that are available, or whether they can afford Medicare premiums, or whether they can find affordable long-term care or support services, or long-term outlook for their health and finances, and about their own ability to manage health conditions to reduce the need to see the doctor. Even for those who feel confident about the aging-related services, the actual accuracy of their knowledge was not confirmed. This data confirms the current literature showing that older adults are currently not proactive in making concrete future care plans. When we think about future care planning as a continuum of palliative care, as you can see in the figure on the right side, future care precedes advanced care directives or end-of-life care. Given that most old adults spend significant time in the future care stage compared to the next two steps, investment in the future care could be actually beneficial for a lot of old adults living in the community. So, with this context in mind, how do we define future care? Future care planning is often defined as considering the provision of financial, medical, and home care and environmental support for future needs. And this includes planning for the housing, finances, healthcare, and personal assistance intended to increase comfort and independence of old adults. What did the literature find in terms of future care planning? Well, there are definitely increasing needs. There are a greater number of adults needing care compared to the younger generation who could potentially support them. The many longitudinal studies found the value of planning for the future care. They found that having future care planning minimized the negative impact of stressors, being they were feel more prepared for adjustment they have to make in case they have a care need, and they were able to mobilize a resource in times of need. Also, people who had a care plan reported reduced worry and reduced distress for future healthcare events. Who does better job of planning for future care? There are several socioeconomic factors affecting these planning outcomes. First of all, age, marital status, education, and race are obvious factors. Family arrangement, such as marital status and number of offspring living nearby, also affected future care planning. Having the financial resources affected positive future care planning as well. People who have had a health crisis in the midlife tend to have a better future care planning compared to those who didn't have any health problems. So interestingly, people who are healthier were less likely to plan for the future. But who needs future care planning? Well, I would say most old adults, but literature supports that these are potential groups of old adults who need to think future care planning more specifically. Old adults who have not had concrete planning for their future care, old adults who have not considered any long-term care planning, old adults whose relatives and family members not live nearby, or old adults who want to age in place, old adults who like to maintain their independence as long as possible. Sounds familiar? A lot of old adults who actually can be considered to be one of these categories. What does future care planning include? There are several essential components of future care planning, especially aging in place, effective communication, resource building, and self-care management. Addressing these multiple dimensional needs is very critical for most old adults. With that in mind, we designed these future care planning sessions to improve the social support of old adults and reduce the psychological distress of old adults. The rationale of the sessions are shown in the figures. As you can see, we are thinking that these sequential steps will lead to the better outcomes. The planning skills the participants acquire from these sessions are expected to increase their social support through effective communication. And this social support, in turn, leads to improved mental health. To achieve goals, we included several activities. That is, preparing for the toolkit, safety and comfort kit for old adults, and communication skills and practice guide, community resources, checklist for the community resources, and sharing ideas and discussion. These are session components. For specific domains we really aim to improve. These are communication, resource building, aging in place, and preparing for the future care decision. Based on the social learning and planned behavior theory, each session will address 4 specific activities, including modeling, improving communication, activating behavior intention, and changing attitudes with regard to end-of-life care. There are also several hands-on activities, demonstrations, and multimedia visual aids that facilitate older adults to adopt in their own lives. In particular, in session 1, we showed a video, How to Be a Smart Patient, which shows how to speak to their doctors and what to anticipate in the doctor's visit. This warm-up video with a bit funny and engaging scenarios often engage and encourage older adults to feel more comfortable and to share their experience with communicating with healthcare professionals. The next activities, including preparing for comfort and safety kit, that are designed to help them to pack their unexpected ER visits or natural disasters such as tornadoes with the power out. The demonstration of these kits have been well received by old adults. In fact, one of the big behavior change they report at the end of session was making the safety and comfort kits. In session 2, we intended to include more resource building and communication with informal and formal care providers about the end-of-life plan. We showed the needs to create a medication list and keeping health records. And we also emphasized checking out the community resource, such as local service providers. The discussion guide included having crucial yet difficult conversation with healthcare providers, family members, and relatives about their end-of-life care preferences. As we did in the session 1, we emphasized the need to marshal support in terms of need from their relatives and friends. These are specifically relevant to rural population where they often do not have adult children or relatives living nearby. Most old adults who also express the need to be proactive in their communication with others about information and support seeking. In the end, we also discussed the importance of having advanced care directives in case they have not done so. Some powerful examples of DNR are shared with participants' feedback and stories. Surprisingly, old adults are happy to share the experience with their loved ones and other acquaintances who have had similar experiences. Thus far, we have received many positive feedback on the program by participants as well as extension specialists. In particular, one participant, after the second session, I learned a lot from these sessions. It covered many areas that I was concerned about. I really like to learn about speaking to the doctors and preparing for a doctor's visit. I found many materials to be relevant, and I can easily make those changes now. Another participant say, I can see why I need to have this conversation with my partners and children. I've been thinking about it, but this program helped me to see how I can start this conversation. Despite relative success that we have had thus far, in the future, we are actually making a lot of changes and refining the programs. Especially, we plan to target more diverse population. Also, we realize that our curriculum is for independent living, relatively highly functioning old adults. So we plan to change some content for a specific population with different needs. Finally, we need to establish the long-term efficacy of the program with a long-term follow-up and see how this program have a lasting effect on their mental and social well-being. Thank you so much for your attention. And if you have any questions and comments, feedback, or learn to more, then please email me. I appreciate it. And also, if you can complete the evaluation of this webinar, please click this blue underline here, and you will be transported to the actual survey about this webinar. Thank you so much.